Hey everyone, Carmen here, digital editor at Ms., and we are closing out our coverage of the National Association for Commissions on Women conference by sitting down with Amy Turk, the Chief Innovation Officer at the Downtown Women's Center, which is a super incredible hub for ending homelessness for women in Los Angeles. And so, yeah, thank you so much for taking the time.
Thank you, Carmen.
And for about the last couple of hours for touring us around this incredible facility. And so I guess I definitely just want to make sure we capture the true scope of everything that you all are doing. So I think, could you maybe start off by telling us a little about what you do and also the history and the mission of what DWC is and does and all the programs that you all are embarking on, sort of the laundry list.
Sure. Downtown Women's Center started in 1978, 40 years ago. We're celebrating our 40th anniversary.
Awesome. Oh, yeah. Happy birthday.
This year. And we started because in this community there were shelters and services, but only for men. And our founder, Jill Halverson, she was doing some social work outreach in the community, and she met a woman named Rosa. And Rosa was in her 50s. She had been homeless for many years. She had exited one of the mental health institutions that had closed down in California and became homeless because there was no safety net or housing plan for many of the people that were staying in mental health institutions. And they developed a friendship, and Jill looked around and realized there were absolutely no services for women, period.
Yeah. Yet
there were women experiencing homelessness. So she literally dipped into her own pocket and brought her, circles of influence together and opened up a day center, a drop-in center. And then about 8 years later, she purchased the building next door to that center and opened up the first ever permanent supportive housing for women. That was in 1986. So 48 women were able to live there permanently. And we offered a lot of robust services for many years, and then in 2010 we had an opportunity to scale that work. So we moved into the building that we're sitting in today on San Pedro Street near 5th Street in the Skid Row community of downtown Los Angeles. And we tripled in size. So we have 71 units of permanent housing here. We have a large day center. Anyone can come in and have free meals and showers and access to a case manager, a mental health counselor, we have a health clinic only for women. And in total, we operate 119 units of permanent housing in 2 different buildings. But off-site, we're supporting 300 women in permanent housing. So we have case managers going to their homes and doing everything it takes to help them stay housed. And you and I just had lunch in our made by DWC Cafe.
Which
downstairs.
Is so cute and incredible.
Yes, I love it too. It's one of the best parts of working here. So it's our social enterprise. We have 2 storefronts. Here is the coffee shop, and 4 blocks away from here on 3rd in Los Angeles is our resale boutique.
Oh, awesome.
And what's really unique about our social enterprise is we have a handmade product line with candles and soaps and journals, and those are all made by women who've experienced homelessness before. And so they're in paid work opportunities, regaining the confidence and skills to emerge back into work.
Awesome. Well, and I know you were a little before when we were on our tour, you were talking a lot about some of the other work that's being done in this area, and I'm sort of curious what were the cracks that Rosa fell through, and which cracks sort of persist today? We know, that women are, 31% of the homeless population in Los Angeles, and I also know at some of the other sessions this weekend we talked about how that's likely an undercount because women are sort of the least visible of the homeless population for a number of reasons. And so, sort of what are the systemic problems that maybe keep women on the streets and also keep them away from the services they need?
Right. Yeah, well, here we go.
I know that's it's another big question.
It is. I mean, there's so many things. Most of the women that we work with are in their 50s and above. And so they built a family. Many of them had jobs, but maybe the jobs weren't paying them as much as the men were making, or a lot of them were in caretaking positions, and perhaps have lost a spouse, and a lot of them are living with severe mental illness as well. And we know in our country the mental health system is really fragmented and broken, and expensive to get good care, and hard to get care if you don't have insurance or money. So those are just some of the inroads. We know that if folks grow up in the child welfare system, they're disproportionately becoming homeless after exiting foster care. Or for various reasons, people find themselves incarcerated, that once they've done their time, exiting jails and prisons can be a very quick pipeline to homelessness. Or people's access to education varies, or access to just housing and resources in general. So there's so many pipelines. There's no one story or one common denominator of why people experience homelessness. But for women, especially women who are not in a family unit, have a hard time finding services that appropriately meet their needs. And we know from community-based research that we've done in our community that 90% of the women that live in the Skid Row community report that they have experienced sexual assault, domestic violence, and or child abuse, or all of the above. So for women, one distinguishing difference between men is just the level of physical trauma and sexual trauma that they've lived through.
Yeah. Well, and what are the what are the other models for these solutions? And I know we were also talking about this a little bit earlier, that obviously what you all are doing is so incredible and very large, and the scale is big. What are some of the other solutions you've seen in other cities, or even here in LA, that are trying to, provide resources to homeless women?
Sure. Well, we do have a network of organizations nationwide that are similar, not necessarily in size to Downtown Women's Center, but in service delivery. And so all of them are using evidence-based practices like trauma-informed care, or helping people identify housing solutions right away, which we call housing first, or realistically working with people who have addictions through a model called harm reduction. So not unrealistically expecting folks to just be sober, just like that, but working with folks to figure out how to reduce the harm of things they're experiencing. And so nationwide, we're a part of something we started, an initiative called the 1 in 4 initiative. Because when we started at the time, about nationwide, there was about 25% of the population were unaccompanied women, for lack of a better term, so women not in a family unit. But since we started, that's grown. Nationwide, that number is now 39%, and locally, like you said, it's 31% in Los Angeles. But there's not enough. So we know we can make a difference in homelessness when we dedicate the research to certain populations, and then we dedicate the resources to those populations. I'm getting away from one of our residents. So for example, our nation over the last 10 years has made a deep commitment to veterans.
Mm-hmm.
And we saw a decrease in veterans homelessness.
Yeah.
And we've made a deep commitment to people that have been homeless the longest, what we call chronically homeless. And we've seen a decrease in that category. So what we need right now is that same dedication and focus to unaccompanied women. Because we know once you have that resource, you will see housing, funding for housing opportunities, and for the right resources going to that population.
Definitely. Well, and that was something that I was curious about. I know that you all do some advocacy, and I'm curious, what are some of the key policy issues that you're focusing on, and sort of what solutions, through, the federal government and through HUD, or even locally, what sort of policies can help sustain and expand this kind of work?
Well, one of the biggest game changers in the last 10 years is the Affordable Care Act. when I started this work, I'm a social worker, about 20 years ago. It was the hardest thing ever to get someone insurance. It was so hard. You had to like go through years of proving that the person had a severe mental illness or debilitating health condition as verified by a gazillion mental health assessments, or, you know, and now we can just get people insurance, and that healthcare can, you know, prevent chronic health conditions from getting worse, which would just, you know, so that we certainly support the AC.
Well, and sorry, just if I, on the local level, have you seen an impact here with your residents, with your community, with the Medicaid expansion that we did with Medi-Cal?
Yeah. So that's what I mean. Like, so now people income qualify for health insurance instead of having to like go through all the hoops to prove your disabling condition. But then tied to that is you know, advocating to the Housing and Urban Development Department, HUD, for more funding for permanent housing. So that healthcare and housing together, and in many cases, housing is a healthcare intervention. Yeah. Because how could anyone get over even a cold or the flu if you don't literally have a safe place to heal? And then add to that, you know, perhaps living with diabetes or a heart condition or any other, you know, longer-term chronic conditions.
Well, and what barriers do you think women face in trying to sort of, well, obviously sometimes it's that the resources just aren't there, you know, that you are a woman who literally cannot find shelter because all of the shelters are for men. And sort of what are the steps that need to be taken to make sure that there's even a facility in every community for women?
Right. Yeah, I mean, that's definitely something to press on city councils, to mayor's offices, to the commissions on the status of women across the nation, you know, that it should be unacceptable. I mean, that's gender discrimination as far as I'm concerned.
Well, and also I love the intersectional approach that you all take, not just around you know, identity intersections. So, you know, serving queer and trans women, serving and focusing on women of color, but also those intersections that we've been talking a lot about this weekend is sort of, you know, the intersection of trafficking and homelessness, the intersection of DV and homelessness, and you all are doing so much really innovative work to also address that and building these kinds of coalitions. What sort of models and blueprints, like what advice would you have to other folks in your field in other cities of sort of how to best close some of those gaps?
Yeah. Well, one initiative that we started with Rainbow Services, a domestic violence homeless services that you sat for their panel just a few days ago. With their executive director, Elizabeth Eason. So we've started together the Domestic Violence Homeless Services Coalition, noting that really in those two service delivery systems, we're serving the same women. Like, literally. The same woman could enter our day center here at the Downtown Women's Center and, you know, at some point in her life need a domestic violence shelter. Maybe she's fleeing domestic violence. But our systems, due to funding stream differences and, you know, in some cases, some philosophical differences don't work well together. And so we said, this needs to end. So we're a coalition of willing homeless services and domestic violence services that are willing to change how we operate. You know, willing to expand our hours, or willing to create advisory boards of women with lived experience and listen to them for what the solutions actually are willing to find permanent housing as soon as possible and not require that someone stays in a secluded shelter somewhere, because is that going to be realistic for the rest of her life? You know, helping her safety plan in different ways. So it's a wonderful coalition. We meet regularly to figure out how to advocate best for best practice funding for best practices, what we can individually and as organizations do to change the system. So that's just one example. Like, when you start to focus one population, that could be good, and you like might see some impact there, but you might also not coordinate well with all the other systems.
Well, yeah, and it was interesting because in Elizabeth's panel, someone who was speaking they were like, well, yeah, if you're fleeing domestic violence, you literally are homeless. And it was, it's such an obvious thought, but it's also a thought that had never occurred to me before. Like this idea that in and of itself is an intersection, that if you are leaving your abusive home, that means, that you may not have somewhere else to go.
Exactly.
And so I'm curious, building on what we've talked about at NACW is, where do advocates have a role, and where do governments have a role, and where do we meet and work together, and what would you say are the ways that feminists can do better by the women you serve here, and women like them, and how do you think decision makers sort of at the local level especially can do better by homeless women and be part of the fight to end homelessness, even in their other, for advocates in feminism who are working in other fields, like doing better to bring them to the table?
When we've been most effective is when we've organized people who have lived through homelessness themselves to tell their story themselves in front of decision makers. Like, decision makers can tell me no all the time. Even though I'll continue to persist and organize around that. But you can't tell someone who is sitting there in front of you who experienced homelessness, who might be really brave to share a trauma experience. You have to listen. You can't be human and not, listen a little bit and think, oh, we should be doing better. And in Los Angeles, frankly, the political will is better than it's been.
Yeah.
And that has resulted in new resources in our community at the city level and the county level as well.
Awesome. Well, and I love that you have, that you do this work where you sort of empower these women to tell their stories, and even can you tell me a little more about, I know you talked about getting them a little more involved, politically and civically, especially with the elections coming up. Like, how do we make sure that these are the voices that are being heard?
Right. Yeah, so Downtown Women's Center has an advocates program, so we train women to tell their stories, to understand how government works, to help come up with solutions that we then put into a policy platform and go out to any, city council meetings, board of supervisor meetings, things like that. And, we're really focused on voter registration.
Yeah.
Making it easy for people who are experiencing homelessness to vote. We're a voting poll place here at Downtown Women's Center.
That's amazing.
Yeah. So, and we're open to the public, not just...
like, take note.
And just trying to reduce any barriers to civic engagement is one angle right now.
Awesome.
Yeah.
Well, I think that's all that I had. Is there anything else that you sort of wanted to leave our listeners with today, or?
Yeah, I think, there's so many ways to be a part of the solution to homelessness. And at Downtown Women's Center, that includes volunteering. We have 5,000 volunteers every single year. You just went on a tour that was led by a stellar volunteer who's gotten to know our services so well that she could come on a Saturday and do it on her own.
Yeah. Well, you're also about to get another volunteer.
Oh, good. Perfect. So it's just, especially now, that is a way to be civically engaged right now and to learn more about the issues so that you can be a better advocate in your spheres. Obviously, we're a nonprofit. We rely on donations from individuals and corporations, foundations, and governments, or grants from government. And shopping in our social enterprises, which are also online, so you don't have to physically come here if you don't want to. But at Made by Downtown Women's Center. So there's so many ways to get involved, whether it's at this organization or one closer to someone's home.
Awesome. And how can folks connect with you and stay in touch?
So we're www.downtownwomencenter.org, and on Twitter we're at DWC Web.
Awesome. All right. Well, thank you so
Thanks,
much
Carmen.
for everything you're doing and for letting us see this incredible facility and share this space with you and your community today. It was really powerful and so important.
Great, and looking forward to working with you in the future.
Yeah, for sure.
Thanks.
Coming in for my volunteer training.
All right.